Why phosphorus becomes a problem in chronic kidney disease? In order to understand this, we need to know what the kidneys do. So imagine them as a filtration system. When a cat eats, all the phosphorus that is absorbed goes through the bloodstream, through the kidneys. The kidneys will filtrate, select what to keep and what to get through the urine. That is, if the kidneys are working well. But when they start struggling, something happens. Imagine, I like to use imagination for all these things. Imagine that you're in a 4-lane motorway and suddenly it becomes 1 lane for everyone that was going around. So what happens is all that phosphorus, all those cars and all that phosphorus starts to build up, to back up, and suddenly it starts building up in the blood. This process is called hyperphosphatemia, and it has severe consequences in the body. When the body detects this, there are 2 hormones that are going to participate in this. One of this is the parathyroid, and the second one will be the FGF23, fibroblast growth factor 23. I know, mouthful. But these 2 hormones are going to push the kidneys to work even harder to get rid of all that excess of phosphorus. If this persists in time, what is going to happen is that these hormones are going to drive inflammation in the body, making the kidney decline faster. The other thing that will be going on is that this pushing through the phosphorus will also cause more damage. And the other one that is quite important is that the calcium is pulled off the bones in order to try to maintain that balance, which weakens them. So one organ that is damaged can cause a lot of problem around. So it's important that we treat this understanding all the mechanics and all the importance, the absorption of the phosphorus, the inflammation that could be around. So it's not just reducing proteins and reducing phosphorus. Organic phosphorus versus inorganic phosphorus. Is there a difference? Yes, there is. And we are reaching the heart of the video. When you read a pet label, you'll find that it says the amount of phosphorus, but it won't tell you where that phosphorus came from. And this is important. It matters a great deal. Organic phosphorus is the one you find in meat or organ tissues in the natural world. When a cat eats meat and this tissue enters the digestive system, that phosphorus contained in that muscle will be bound with a lot of proteins and other things. And the body will have to work hard to release it, and will release it gradually in a low, steady release. This means that the phosphorus won't be absorbed altogether, and it will only get absorbed around the 40 and 60%. When we talk about plant-based phosphorus, the one included in, for example, grains, because the cat is an obligate carnivore, doesn't have the enzymes to break down all that grain. It doesn't do it efficiently, at least. And that means that most of that phosphorus won't be absorbed at all. This doesn't mean that the cat is a cat's diet should be plant-based because it's beneficial. It is not, because they are obligate carnivores and is not the right fuel. And we talked about that in previous videos. When we talked about grains, we talked about carbohydrates and how the cat deals with that. So it is the least absorbed phosphorus, but not the right one for a cat. When we talk about inorganic phosphorus, we are talking about those manufactured mineral salts. The ones that most common are sodium phosphate, calcium phosphate, and phosphoric acid. And when they enter the bloodstream, they are highly absorbable. They are soluble and really highly absorbable. This means that there is practically no digestion. That phosphorus floods the bloodstream, gets absorbed 100%. And this is the one the pet industry uses the most because it has its functions, and we'll discuss them later on. So at this point, you may be asking yourself, okay, but if we're using inorganic phosphorus in pet food, it is correct, it is right, the right thing to do to reduce phosphorus in renal diets. But what if we are reducing the phosphorus too soon? What if it is not enough? Why don't we think about doing natural and good quality proteins with good organic phosphorus instead? Instead of treating every single kidney patient the same way, let's talk about individuals, staging the kidney disease, making sure that we measure calcium and phosphorus, that there is the proper ratio that we're going to be talking later, and think about if we need to reduce phosphorus or not. Phosphorus is the core building block of ATP, known as adenosine triphosphate, and is the source of energy that every cell needs. Every heartbeat may require millions of ATPs. The muscle contraction may need loads of ATPs. And it's important that we keep the phosphorus levels good so we can keep having energy, good muscle contraction, not weakness. And this is one of the symptoms that we see in kidney patients. Not only because of the muscle waste, they maybe also be depleting all the phosphorus they have and having that weakness in the body generally. When muscle waste starts showing because the cat is not eating well, because we are not feeding the right foods, that phosphorus can also be problematic because, again, it is not the right amount and it's caused by a process that it's trying to regain balance in a sick animal. This happens a lot when any organism gets sick. Sometimes all the systems start to, okay, we're going to help you with this emergency that is happening, this unbalanced system that is working. So we're going to try to and regain that balance, but at the same time, I might be using more resources than I already have. So in the long term, it will cause some damage. It will save me now, but it will hurt me tomorrow. And this is important. In all diseases, we can't just tackle symptoms. We need to understand what is going on and how to help the body fully, not just the affected organ. So, how do I make the best decision for my cat? What do I feed him if suffering from kidney disease? The first thing you should do is to make sure that the diagnosis of kidney disease has been properly done. In order to do that, you need to get a full blood panel with biochemistry and CBC, a complete cell blood count, and a urine test with specific gravity, see if you're losing protein in the urine, ultrasound as well, blood pressure, and try to understand all that is going on in your cat's body. If there are other ongoing diseases at the same time, so you need to get a full picture of what's going on. It's not just about measuring urea, creatinine, and SDMA and phosphorus alone. Phosphorus should be associated to calcium making sure that there is a 2:1 ratio of calcium and phosphorus. So every 2 parts of calcium, 1 part of phosphorus should be associated. So it's important that you look at this, and from that point, you'll make this decision of, do I need to reduce phosphorus or not? And there are ways to do so, but this is where the rest of the body will play an important role. If your cat is suffering from constipation, if your cat does have any digestive issue, if it's losing weight, not eating properly, if there is muscle waste due to hyperthyroidism or any other thing, you need to treat those things in order to make sure that you know how much of that phosphorus is absorbed. The second thing would be to feed them a good soluble fiber. This will help to keep the gut clean and able to move, reduce all the waste of nitrogen around. It will help to keep a healthy gut, and it is phosphorus that is not going to be absorbed because it's a plant. You feed high quality proteins when you're facing a chronic kidney patient. If you feed them high quality proteins, ultra processed foods are not the most indicated, not even canned food. And if you want to control the quality, you need to know the ingredient perfectly, how it's been manipulated in order to get to your cat's plate. And then after all that, if the phosphorus is out of its way and you have an uncontrolled kidney problem, then you have the phosphorus binders. Sometimes they'll give you the supplement right away. Those supplements are known as phosphorus binders or renal whatever supplement. I don't want to mention any brands. And these ones most of the times contain calcium carbonate or other binders. But if your cat doesn't need them, make sure to select the supplements that your cat actually needs. And one of them would be reducing inflammation. So a good diet is the primary supplement and fundamental nutrition that it needs to get. After you've done all of that, and you have a right diagnosis and the phosphorus, there is no possible way to manage that amount of phosphorus, you have an uncontrolled kidney issue, then we go and find the phosphorus binders. Phosphorus binders are only given if you need to control the amount of phosphorus in the diet. After you try with good foods, if you've done all the tricks and then you're still having a problem, then we have phosphorus binders to help. The problem with them is that if given too soon, you may be reducing the phosphorus needed from the body, producing weakness, or maybe they don't want to eat properly because they don't have enough energy. Given too late, probably won't work. So it's important that you have a right diagnosis, a fully panel, and everything done to make sure when is the right time to use phosphorus binders. The most common phosphorus binders will be calcium carbonate for sure, chitosan as well. It would be also aluminium, hydroxide, and lanthanum carbonate is the most new one. Each of them will have a particular way of working. The most recent one, the highly effective, is the lanthanum carbonate, but not all cats will tolerate it. Calcium carbonate is easy, but if not given in the right moment when they are eating, you cannot just feed them any other time. It won't do anything. Aluminium hydroxide, it's still feeding something that it's not too natural, aluminium, right? And so on. So you need to make sure to think about and talk to your vet about what type of binder and when to use it. But alone, they won't be doing anything for your cat. you need to address all the previous things we discussed about. So let's close this video with a quick checklist. Check the label. Check the amount of phosphorus. If it mentions what type of phosphate or phosphoric acid is there, see if it's reduced or not. It is to enhance the flavor or not. Just read the ingredients, look at it, and start paying attention to those details. Where possible, favor natural cooked food or raw food over kibble. Wet food is a bit tricky because most of them will also contain some phosphates and anything else. So check the labels as well. If you prepare the food at home, never feed just muscle meat. And this is a common mistake I see. Oh, my cat eats chicken. Chicken and what? How do you cook that chicken? So it's good to get some advice from a nutritionist or a natural holistic vet that will guide you in homemade foods. And it is important that don't stop yourself at, okay, I need to reduce phosphorus. Look at the full picture of your cat suffering from chronic kidney disease. Thank you for watching, and I'll see you next time.